Hello, everyone. Welcome to our webinar. We will be reviewing perioperative management of the lactating patient in the ambulatory surgical setting, led by Dr. Kara Barnett. I am Elizabeth Reith, an Associate Professor of Anesthesiology at Memorial Sloan Kettering Cancer Center in New York, New York. I will be moderating this webinar. For those of you who are not SAMBA members, please consider joining the society, as it offers many benefits to members. Please visit our website, www.sambahq.org, to see the benefits of membership. A few quick housekeeping notes before we get to today's presentation. Please note that this webinar is listen-only mode. In the upper right side of your computer screen, you will see a GoToWebinar control panel. Through this control panel, attendees will have the ability to contact our staff via the question box. We will have time for Q&A at the end of the presentation, but please submit your questions throughout so that we can prepare to answer. At this time, I would like to introduce tonight's speaker. As you already know, our speaker is Dr. Kara M. Barnett. Dr. Barnett is an assistant attending anesthesiologist and director of anesthesia services at Memorial Sloan Kettering Cancer Center Monmouth Regional Site in New Jersey. She has been with MSK since 2009 and was active in planning and opening MSK's only freestanding outpatient surgical center in New Jersey in January 2017. At MSK Monmouth, Dr. Barnett solely cares for surgical, GI, and interventional radiology cancer patients. One of her passions is caring for the perioperative lactating patient, and she has published and presented on this topic. Over to you, Dr. Barnett.
Thank you, Dr. Reith. Hi, good evening, everyone. Thank you for joining. I hope you're all safe and healthy. Tonight, we're going to discuss my passion, which is how to take excellent care of the lactating or breastfeeding perioperative patient. I wanted to take a moment and tell you why this is so important and why I applaud you for joining me tonight. I asked some mothers about their experiences with anesthesia and breastfeeding. One mother told me she had surgery recently while breastfeeding her 5-month-old, and not one person in the hospital told her the same piece of information. She had stress and frustration as she unhappily and needlessly threw out breast milk. Same for the mother of an exclusively breastfed 9-week-old preemie who had an emergency D&C for retained placenta, and she was told to pump and dump for 24 hours. She reports that it was so hard and painful to watch her hard-earned breast milk go down the drain. Another misinformed mother told me she pumped and dumped after a thyroidectomy and reports it was like pulling teeth procuring a pump in the PACU because she did not think to bring hers with her. A mother told me she had major surgery with anesthesia recently while she was nursing her 2.5-year-old. When she asked her surgeon when it would be safe to nurse afterwards due to the anesthesia, she said, and I quote, "Well, it would be a long procedure, so maybe she will finally wean." On the day of surgery, she asked several staff, including her anesthesiologist, when it would be safe again, and she got different answers, ranging from 2 hours until after waking the next day. This left the mother very confused. Another mother told me about an experience that she had with an ER that I think is relevant. She was given Keppra and says, and I quote, that I couldn't continue to breastfeed my then 8-week-old after nursing my oldest to 28 months. For what I thought would be forever. And it was the hardest part of the scariest moment of my life. The ER probably didn't give their advice a second thought, but a few physicians taking my concerns seriously really changed my life. She had contacted a neurologist who was able to tell her it was safe to breastfeed. This changed her life. So let's get started and see what lives we can change. So I have no disclosures. So tonight I will cover everything an anesthesiologist should know about caring for lactating patients who come for surgery, emphasizing ambulatory surgery for this discussion, but I'll also include a bit about non-ambulatory surgery. I'll try to make this a little more interesting by telling you our story of how we developed a supportive program for lactating patients at MSK, covering preoperative, intraoperative, and postoperative care. We'll discuss perioperative medication compatibility and staff and patient education and relative resources available to both. We'll start and conclude with a case of a breastfeeding patient with bladder cancer who was scheduled for cystoscopy and transurethral resection of a bladder tumor at my outpatient regional surgical center. If there's anything at all that you can take away from my talk today, I'm hoping it is that anesthesia is almost always compatible with breastfeeding, and it's unlikely you'd have to tell a mom to pump and dump for 24 hours. I wanted to introduce this case to you now so you can start to think about what you would do if this were your patient at your surgical center. And as this presentation continues, your ideas may change. So we had our first lactating patient at my outpatient regional surgical center. She was a 32-year-old woman with bladder cancer. She was scheduled for a cystoscopy and TURBT, and she was identified as breastfeeding a 5-week-old infant. We typically do a general anesthetic with LMA for our patients that are getting TURBTs, and we also typically give a belladonna and opium suppository in the operating room while they're asleep, and then